so this paper really has two roots in my research stream. One is a paper I did with Ed Bernardus, who is still sick and couldn't do this. That came out in Strategic Management Journal in 2015. That paper is about how you learn from your competitive position. And so that contributes to this. And then the second paper is a 2014 Journal Supply Chain Management paper where we showed how buyers can influence learning by suppliers. So taking learning upstream and determining who you learn with and who you cooperate with, sort of involuntarily. So this paper, we wanted to bring those two things together, this competitive piece and the cooperative piece together, and absorptive capacity is a good way to do that. It's the idea that to learn, you really need two things. You need to be willing, and you need to have access to sources of information. And that's usually been cooperative relationships, supplier partners, supply chain partners, alliance partners, where you have a free exchange of information. But that only works for some things, right? So that's great if you're doing radical innovation and you're doing something completely new to the world, then you need to do that because you don't have all the ideas. However, if you're imitating or differentiating, if your new product is the same but slightly different, or it's a direct imitation, you still have to learn how to do it, but you don't learn the same way. We don't learn from the same sources. So the idea of this paper is that when you do product development, there's really three outcomes. You can be radically new innovation, you can be differentiation, you can be imitation, and that the structure of how you learn depends on. You couldn't use tools for radical innovation, won't work very well for imitation, and relationships won't work. So, and then the imitation side, which is most new products are imitations, is driven mostly by competitive position, by looking at what competitors are doing rather than struggling to do something new. So that's where it came from, is this push to get supply chain research to look beyond the buyer-supplier relationship, which is my thing. So the paper develops theory around those ideas, around the idea that absorptive capacity is there's different profiles, there's different sets of characteristics for the development processes that permit organizations to learn, right, and to learn different things. So clearly, you would expect that firms that have a lot of practice doing any of those three processes would learn how to do it. They would develop a generic product capability or a differentiated product capability. They would learn how to tweak things. There's also so that's in the paper, and then there's also this sort of generalized R&D capability, which is the ability to take things like basic science or new technologies and incorporate them into processes, and also the ability to do new stuff, to actually develop new things. So those are the standard things you would do in most absorptive capacity research. What we added is the idea that alliances matter, and where you are in an alliance network matters as information flows to you. Then you're in a position to put new things together and arrange new configurations for new products, and that's typically treated as alliance network centrality. So you're on you stand between a lot of other sources of information and they all flow through you. That's also pretty conventional for absorptive capacity research. That's where most of it's gone. What we did differently, what we added to that was this notion of competitive exposure. So you're in a competitive position. How do you decide what to imitate, right? How do you learn what's a good imitation target? And so we developed a measure of competitive exposure that looks at when I pay attention to my competitors, I don't just pay attention to the products that compete directly with mine. I pay attention to everything they do. So I get to look at markets that I'm not in yet. And that's an idea from competitive dynamics theory that seems really relevant here, because the idea that you're just going to imitate the most profitable or the most technically similar products is not what happens in the world. Firms do imitation for competitive reasons as well. So those are the four main pieces of the research. The study, we used data from the Food and Drug Administration's drug application data. So there's the FDA publishes lists of approved drugs that are actually being manufactured in fact, they maintain a current list of everything that's on the market or approved to be on the market. And they also publish the approval process. So when a drug is approved, what it is, what it's used for, so on. So we have really good product market information for pharmaceuticals. And then we combined that with the formularies from a couple of large prescription benefit managers. But the formulary is the list of drugs they're willing to pay for, so that we actually have markets, so that we know that drug A and drug B are both treat the same kind of condition. And those are all based on the World Health Organization's anatomical therapeutic classification system. So we have good product, we have good history, we have good market definitions, and then we also went out and got from SDC Platinum joint venture and alliance and merger data, so that we know which firms, we know how firms aggregated as they bought each other, and we know who was working with who on what. To some extent, I mean, it's not perfect, but it's certainly the best source out there. So we have all the pieces we need for this in pharmaceuticals, and pharmaceuticals is a really good setting for this because about 80% of new applications are generics. They're bioequivalent compounds that are supposed to be exactly the same, right? The standard is bioequivalence, but actually it's the same molecule. And we have differentiated products. Or for instance, when you take a drug and you make a pediatric dose, right? So from an adult dose to a pediatric dose, that's a new market. You've opened up a new segment. It's the same drug. The route of delivery is probably different. The strength is probably different. Maybe some of the other elements in the compound will be different. So that's a differentiation as we spread out the market. And then we also can track radically new drugs. There's an FDA process for whenever there's a molecule that's never been tested in humans, it has to go through an additional set of steps. And so that lets us tag those as radical innovations. And then the methods, one of the interesting things about this paper was the back and forth about methods. I had to learn a whole bunch because the tendency in a lot of journals these days has been to over-identify the model, to be very, very specific about nailing down all the pieces of endogeneity and other issues in the model. And I would rather have good theory, but you have to do both. So we adopted a method we had used before, which is generalized linear mixed modeling, which it has the regular fixed effects of linear modeling, but it adds a random component, in our case, at the level of the firm, that, essentially we allow the intercept to vary by firm, and that is a way to detect unobserved, the effects of unobserved variables, right? So if the random component is significant, that means your model's not fully identified. You don't have all the pieces in it, which is one of the biggest pieces of endogeneity. So we used that. That was something we picked up partly from the reviewers, and it makes a huge difference when we look at the results. We look at the findings. If we do conventional modeling, then everything works out the way you would think it would. So the capability for doing radical innovation or differentiated innovation, because you've done it before, just plain, how many times have you done it before, is significant if we don't do a mixed model, but it's not if we do, right? And what does that say? That says that our measures of things like experience are really crummy. We are not actually measuring what's, it's a bad proxy for what firms actually know how to do, right? For the know-how and capabilities that firms have. So that falls out, which was not unexpected, because, if I'm just counting up how many times I did something in the past, that doesn't necessarily work. We did have one interesting result around that, which was that as we shortened the time lags between the outcome, how many products did you produce this year, and experience, as we brought them closer together, the direct experience started to be significant again. So it's not how long have you been doing it, it's what have you done lately that matters. So that was interesting, and that's purely an artifact of the reviewer pushing us into this method. So there's that. So there's a contribution there. Then what we found is really three different profiles for absorptive capacity. That there's different sets of attributes and factors for firms when they pursue these strategies. So, and it's not like a firm only does one, because say big pharmaceutical companies will do generic drugs when it's in their interest. So, for instance, EpiPen. I don't know if you have anybody with anaphylactic shock. And so when Mylan was called before Congress to explain their enormous price rise in EpiPen, it went from $300 for two to $600 for two, and it had been $100 for two. One of their responses was to put out a generic version of the same product themselves. Right? So, well, we'll sell it for half. It's exactly the same thing, but it doesn't say EpiPen. So firms do this. They do all of these things all the time. So what did we find? First of all, radical product development is the domain of big publicly traded firms, and little tiny firms that don't do anything else. They're really just researchers developing a drug, and then they get bought by a big firm. So radical innovation is really a domain of that combination: big firms buying out little firms. When we looked at the sort of generalized R&D capabilities, sort of patent based, how many patents you develop. That was, as expected, positive for radical innovation. but we didn't expect any relationship for generic drugs, for imitation, and it's negative. It's actually symmetrical, and then the differentiators are positively related to that. So, but more weakly, it's not as big a deal for them. And then the real contribution, the competitive exposure, which we expected to be negatively related to radical innovation and positively related to imitation, turns out to be positively related to all of them. It's in fact the strongest impact in the paper. So the thing that determines how much product development, if we were to say what matters most for the pharmaceutical firms selling drugs in the U.S., it's how many product markets are you exposed to through your competitors. And so instead of thinking about product development as a search for blue oceans, well, you could still think of it that way for things, but it's also a search for ways to compete. And it appears to shape, to a large extent, any kind of product development there is. So there's a definite future for looking at motivations for product development research and supply chains to sort of untangle, is that the same for firms that are doing radical innovation as it is for imitation? We can't tell in this paper, but it's certainly a future piece. And then the last one would be the alliance network centrality, which has been this is cooperative knowledge exchange and so on, and has been the sort of the key finding in all this research. And we expected it to be positive but U-shaped, quadratic. So increasing at a decreasing rate over time, so that the more central you are, you don't get increasing results. It flattens out. And we found that for radical innovation, not for differentiation, and then a positive relationship for imitation. So imitation benefits from network centrality, but it turns out to be a different network. The network for things like R&D is we know what the relationships are. For R&D tends to be hospitals, researchers, right? Different kinds of partners. For imitation, it's OEM manufacturers. It's outsourcing. It's that being central in a network of suppliers who can and distributors who can work with you to introduce drugs. It has the same sort of effects on imitation as it does on radical. I mean, it's the same sort of effect. You don't want an endless network. There's a sweet spot where the inflection point changes. So we get three pretty different stories. What do we do next? I have a study that just went into review that's just me, on the competitive dynamics of imitation. So when I imitate, is the goal to disrupt a competitor or to enter an easy market? And the easy market wins. So that paper's out there, and it speaks to how supply chains develop, right? How does a market get 25 competitors? You would think that after third or fourth competitor, people would stop entering, but they don't. So, for instance, in a fairly stigmatized market these days, oxycodone, 21 companies make oxycodone. It's a really attractive market. Nobody will defend it, right? So everybody's making money. so there's no competitive pushback. That's a very typical sort of entry. But if we look at things like hepatitis C treatments, which is very competitive right now, we're not seeing a lot of entry because any entrant knows that they're going to be slapped down, that they're going to be attacked. So it depends on that structure. And then what I really hope the field does is to start look at supply networks, not just as this firm's suppliers back 3 tiers, and really should be looking at the supply network plus all the suppliers, other customers, right? They're really relevant, right? And comes down to the focal firm's peers, to their competitors. You should be looking at who supplies who, and in a competitive sense, rather than just how do I get along with my suppliers and innovate with them. It's critical, and I think supply chain managers know it and do it. At least we have some evidence that in this paper that in fact we're paying attention to competition. So for practitioners, well, first of all, experience-based product development capabilities. Just because you've been doing it for a long time doesn't mean you're good at it, right? And that's especially true when we get to radical innovation. If you read the paper, these are capabilities and know-how that erode fairly quickly as the world is changing. What you know before doesn't necessarily work. And the other main takeaway is that managers should really think carefully about which cooperative relationships matter. What makes a good partner is not just they deliver on time in the quantity and quality desired. Certainly that's important, but what do they know? Who else are they connected to that could, that's a source of information. That potentially your supply network is a source of opportunities for deciding which markets to compete in, what products to develop, what products to not develop, just be fairly important. Being tied to too strongly connected, tied to a specific supplier might lock you out of other opportunities. So there's a number of implications in this paper that argue against the idea that we should develop close, long-term, exclusive supplier relationships. It's stultifying. It freezes what you're able to learn from your connections. So, and that depends partly on what you want to do, because this paper shows, how you learn absorptive capacity is not a one-size-fits-all proposition. So I think that's the paper. I hope people will come and read it. It was a lot of fun to do, and I had a great team. So it's me, Ednilson Bernardus from West Virginia, Mei Lee from Michigan State, and Steve Creek, who's at Appalachian State. Great team to work with, and we of course had a lot of help from reviewers and editors and especially stats people at our universities.